A report from the World Health Organization says COVID-19 likely originated from animals. That's according to a draft copy obtained by the Associated Press. But before the full report is released tomorrow, there are questions about the validity of the findings. CBS News' Natalie Brand reports from the White House.
The Biden administration is already questioning a World Health Organization report looking into the origins of the coronavirus.
We've got real concerns about the methodology and the process that went into that report, including the fact that the government in Beijing apparently helped to write it.
The report is expected to say the virus was transmitted from animals to humans, likely through wet markets in Wuhan, China. But others, including former CDC Director Robert Redfield, say it's still possible the virus leaked out of a lab in Wuhan.
It might not be the most likely scenario in how this virus got out, but it has to remain a scenario. And I think at the end of the day, we're never going to fully discharge that possibility.
There are concerns China put tight limits on what WHO investigators were able to see. While the origins of the virus continue to be scrutinized, the Biden administration is dealing with a rise in cases in the U.S., increasing the pressure to accelerate vaccine distribution.
We have so much to look forward to, so much promise and potential of where we are, and so much reason for hope. But right now, I'm scared.
6 states, Kansas, Louisiana, North Dakota, Ohio, Oklahoma, and Texas, are expanding vaccine eligibility to all adults beginning today. 3 more states will do so by Wednesday.
We are vaccinating the country as quickly as humanly possible, now averaging 2.7 million vaccinations over the last 7 days.
Moderna announced it has already shipped 100 million doses of its vaccine, with plans to ship 40 to 50 million doses each month. Natalie Brand, CBS News, the White House.
For more on this, I want to bring in Dr. Ogechika Alozie. He's an infectious diseases specialist as well as a member of the Texas Medical Association COVID-19 Task Force. Doctor, what do you make of these discussions about the origin of COVID? Where do you think it originated from?
I think that, as multiple people that you showed on this clip said, we're never going to know. There's going to be a lot of assumptions. There may be some theories on both sides. I think sort of the natural thinking scientifically is it could have come from a wet market. But the involvement of the Chinese government in the process brings a lot of suspicion and a lot of concern into the final report. I think one way or the other, right, whether it was a wet market or whether it was a lab, the world, and especially the United States, we took steps that potentially prolonged the spread of the virus in the country. And so I think we need to figure out how we get a handle on that. The vaccines are really the driver of how we get there.
Dr. Anthony Fauci is warning the U.S. could be at risk of a new surge of coronavirus infections as the number of daily cases remains at a plateau. Why are we seeing cases remain so high right now, despite the number of vaccinations? And what would you advise people to do now because of it?
Yeah, I think the northern states have seen a return to that kind of spiking, right? And some of the southern states haven't. I think the weather plays a role, potentially how people are engaging. But again, remember, if we look at the demographics of some of this, we're seeing it in the 10 to 25-year-old range. And so schools may be a driver of that. Not to say that kids shouldn't be in school, but it's a reality. As people ask, well, what should I do? I think the reality is this. If you have the opportunity to get vaccinated, the vaccines work. And a CDC study recently showed the massive reduction in cases that you can get in populations that have been vaccinated, especially healthcare workers. Apart from that, continue to be safe. We're going to get to a point in the next few months where the supply will outweigh the demand. Anybody that wants to get vaccinated will be. And I think summer going into the fall are looking much better today than they did just 30 to 60 days ago. Good advice, Doctor. Former coronavirus response coordinator Dr. Deborah BIRX told CNN that America's coronavirus death toll could have been much lower. Let's watch what she said.
Well, I look at it this way. The first time we have an excuse, there were about 100,000 deaths that came from that original surge. All of the rest of them, in my mind, could have been mitigated or decreased substantially.
Doctor, what do you make of what she said?
I mean, I think it's regrettable that if we say there were 100,000 and we as a nation are responsible for the other 400,000, that's regrettable. I think, again, though, there's a lot of people that want to say, well, she's responsible or whomever may have been in the room is responsible. I think it's really hard for people that have never been in that position to be in the trappings of power and the influence of power to throw blame. They did the best that they could do under those circumstances. I think a postmortem will be done at another time. I think our energy and our interest has to go in to reminding people we're almost there. Get the vaccine when you can. We can do a postmortem and honor those lives that were lost tragically into the future. I truly don't believe this is the time to have that discussion because we have a lot of work ahead of us. To focus on that now sort of makes the assumption that we're done with this, and we're not done.
Finally, you are a member of the Texas Medical Association COVID-19 Task Force. So I want to ask what the screening is like for COVID-19 at the border detention centers as we are seeing these influx of migrants.
Yeah, so I'm in El Paso, Texas as well, right? And so we're sort of in that, one of the ground zeros of that. And I've personally been involved in some of the walking of the spaces, looking at the safety measures that they have going into place and some of the testing. I think it's important for people to understand that on average, majority of the people that are coming across as migrants have been screened for COVID on the Mexican side by a multinational agency. And so majority of those people coming in are COVID negative. There's a specific area where those that are COVID positive, for whatever reason, are also staying. And all the staff that are there have been trained on proper PPE use. People are tested. People are using adequate screening measures, distancing measures. And so I really, truly believe that's as safe as possible. I mean, people that are trying to say that potentially that is driving a surge, well, guess what? We're in Texas and we haven't seen that surge. And I think it's important that, again, not to politicize this, but the clinicians and the public health people and the volunteers that are involved in it, they're doing the best that they can in a difficult situation.
Dr. Alozie, thank you for your time.
Thank you very much.